COP29 is actually beginning today in Azerbaijan, and people have been thinking that when you talk about climate change, it's all about environment. But you have said that there's a nexus between, climate change and population health outcomes. So how do they connect? And then what are you doing about this?
So climate change is a wicked problem. It's complex, it's insidious, it's happening, and you are not aware that it's happening, but it has implications. So if you look at the climate vulnerability assessment that we had, the most vulnerable part of the country is also that country that has the highest child mortality, fastest population growth rates, and all kinds of ecological challenges as well. Even though all parts of Nigeria are vulnerable to the impact of climate change, but there are some that have immediate vulnerability, and ultimately, as things evolve, we see all parts of Nigeria being vulnerable. And there are many implications. One, rising temperature impacts just human body, the air quality, indoor air quality. We've seen the flooding and droughts. The flooding also expands, pollutes the water that people drink can be easily contaminated. We saw with floods in Maiduguri and many other states. So enteric diseases, cholera, can become more prevalent because of flooding, because we have fecal contamination of drinking water. You've got the impact on the nutrition, because some of the malnutrition we're seeing, food systems are impacted, because agricultural productivity can be impacted, because the duration of rains have changed. They have become errant, so that farmlands get destroyed, and the yields for farmers can also get reduced, and you see acute nutritional vulnerability also manifest from that. In addition, you also have the stresses of dislocation, the mental health impact, the uncertainties that actually is coming in this world that we have. We luckily don't have fires, but in other parts of the world, there are wildfires that dislocate. That brings in uncertainty and mental health. So it's something that is also pushing populations to move, as well as expose them to new pathogens. So you have new re-emerging pathogens. In Nigeria, for instance, we saw dengue in northwest earlier, 12 months ago, for instance, dengue fever, which is a viral disease, resurgence of malaria. The seasonality of malaria is beginning to change because the rains are longer. Yes. So you have the transmission in areas where it's intensely seasonal. It's becoming less intensely seasonal, and you begin to see malaria in November, December, January. And that's something that we should be worried about, because the ecology is changing, the rain patterns are changing, and the vectors also are adaptive. And things like yellow fever, which are also vector-borne diseases, because the vectors then grow in areas where they had not grown. And that can lead to spread of disease that may not have been seen, and other diseases that may come into the fore. So at the end of the day, we need to build resilience. And we came out with the idea that our population, our communities need to know that this is happening. Because unless you know, you may not be able to connect the dots. And our traditional leaders were there so that we own this and realize we need to adapt. It's about adaptation. We did not cause it. We did not emit the greenhouse gases, but we need to adapt. And that adaptation includes building community-anchored primary healthcare systems that have the health workers that are aware, at least from the health perspective. Of course, there are other sectoral ways to deal with the adaptation, but from a health sector perspective, to be resilient, to have good surveillance systems, to be able to respond to emergencies appropriately, to be able to build the financing capability that will be able to respond when challenges occur, whether it's flooding, whether it's a new outbreak of yellow fever or dengue, that we're able to respond. That will allow us to be resilient, meaning if there's a crisis, then we bounce back more quickly. So those are some of the things that we're embarking upon to position Nigeria in this world that is increasingly uncertain, not only on the political and economic fronts, but also on the climatic fronts.
So, Honourable Minister, what that simply means is that it looks like climate change is a bigger health challenge than environmental.
It is a significant health challenge in the era that we are going. In fact, if you think about COVID-19, which is a major disruption globally, climate change and its impact as we go forward, I think could be as significant, as much if not more. But it's a wicked problem. It's insidious. It's happening, but you may not know that it's happening. When you look at acute malnutrition, you may think, oh, it's just food production, it's just insecurity. But there is an element of climate. When you see massive flooding of many states, farmlands underwater, when you see rising cholera outbreaks, for instance, or when you see some, like what I mentioned about malaria, we had modest reduction of malaria, not necessarily because of lack of effort, but because the parasites are growing, because they have places to brew. And then the tension, the mental health challenges. So it's a complex challenge. And the idea is that we should be aware of it, and we should plan for it. We cannot just hope that it will disappear. We need to be able to plan how to adapt to that reality. And for those who are responsible for driving this climatic shift globally, I think it's a matter of social justice, that they also alleviate, help the countries on the receiving end to adapt, countries in the Sahel, countries like ours, who need to adapt to this reality which they did not cause. And so that is the import of the conversations at the global level, that in fact it's really the humanity, is the health of the planet, and that there is an imperative of social justice to allow, to invest in helping build the adaptation mechanisms, so that there is resilience in communities, resilience in health systems, in food systems, and many other arenas.
So, Prof, are there any, can we say, like peers? Because this is a global thing. Is there any, similar countries that have similar circumstances like Nigeria that perhaps we can probably borrow one or two things from? Because you've really outlined, the trailer load of things that you're going to need to do, which seem pretty difficult tasks.
I think every country has its own specificities. If you look at our region, let's say in the West Africa region, whether it's Chad, Niger, Burkina Faso, Mali, they've got a particular challenge because the demography is there, high fertility rates, high population, very youthful, but also the changes in the ecology. That's a way that they will adapt. Even within our country, the Lagos, Bayelsa, rivers, there are certain challenges that they have. So the idea is you should be wide open in terms of your perspective to understand your own context and what it means within your context and how you are able to adapt within your context, your context of governance and your resources and your peculiarities.
Yeah.